Hey everybody, we're going live for the first time, Health From Within Family Wellness Center. This is our 12th health hack, and this is the first live one, so I'm really excited. We've done some live stuff before. Maybe you've seen me playing with some of my little friends, like little Cordie and Sunshine Ray. You've seen us doing some testimonials, but this is the first health hack. So today what we're talking about on the chiropractic birthday, yeah, that's right, it's BJ Palmer, DD Palmer. It's chiropractic's birthday today. 1895 was a great year. This amazing profession was established. And today, what do you know? We're going to talk about one of the leading things that chiropractic used to be known for. Yeah, that's right. In the 18 and 1900s, chiropractic was known for really being great for influenza, otherwise known as the flu. So I thought, hey, what a great opportunity to have that conversation on the chiropractic birthday. Because so many of you have forgotten that this whole influenza flu thing, like you guys, I mean, the worst thing that you do is you sit around all day after you get your first bone rocked, of course, and put in the right place. And maybe somebody feeds you like chicken noodle soup. Hopefully it's organic from Jimbo's. They have a great one, right? And you sit in bed all day long and you beat out that influenza. You allow your body to burn off those negative bacteria, those negative germs, and you allow it to get out of your system. There's no better time to get adjusted than when you're dealing with some type of sickness. And I don't even like to call it sickness because it's really expressing health. Your body was designed to burn off bad bacteria. It was designed to burn it off. It was designed to burn off germs. And when it's burning it off, that's when your immune system is at its height. That's when it's working the greatest. So your brain and your brainstem and your spinal cord control all the functions of your body. They control your healing potential. You know, in several of the other health hacks, we've talked about that innate potential. Like my little baby, little Cordie right now, he's playing around, fooling around over there on the floor, tossing things around, right? And that's what happens when you get reconnected to life. When you're reconnected to life, that brain and spinal cord can communicate to run you. And so what we say is that disease manifests itself, starts out as influenza and the flu, that's dysfunction in the body, and it starts turning into other things when we allow it to get out of control. I just want to show you some facts and figures to support what I was saying a second ago, right? Way back in 1918, right? Chiropractors, there was a research study done in which chiropractors worked on 46,394 people, right? And out of 46,000 people, 1 out of 859 actually experienced death. Whereas MDs saw like 93,000 and they had 1 out of 15 deaths. Why am I showing you those stats? Because we used to be known as a profession that was designed to work with your immune system. But now most guys are trying to work neck and back pain because what they're trying to do is they're trying to get that insurance money. Can we help with that? Certainly. But the big thing that I want to point out to you is it's all about your nervous system. It's all about your brainstem, your spinal cord, right? So I thought no better than to talk about flu shots and influenza, right? This is a conversation we need to have because even patients under care sometimes, they'll get mixed up because there's all that dogma and all those false belief systems out there, right? Telling them to do a shot and then, you know, you go to the grocery store to like pick up some eggs now and they're trying to do it to you. I'm not going to go to the grocery store, ask the guy that's bagging groceries, hey, you want to give me a shot? Hey, just give me a shot real quick. And what's that even doing in the first place, right? Is it getting to the cause or just treating the effect? It's treating the effect. So I got some stats for you. Not some stats, actually some ingredients, excuse me. Here are the things in that flu shot. Aluminum, antibiotics, egg protein, formaldehyde, MSG, right? All these crazy things. Thimerosal. These are all the things that are in your flu shot, right? And you're putting them into your body. And it's also got strands of flu in it as well. Why would you want to put that in your body? You know that, I was telling a patient this the other day. You know that they tell pregnant women, the medical doctors do, not to eat a can of tuna because of the mercury in it. But then we inject that into your body? That's crazy. So you see people, right? We see people all the time with mercury amalgams in their mouth, and later on in life, they start experiencing multiple sclerotic or multiple sclerosis-like syndromes and symptoms. Why is that? because those amalgams start to break off, and that mercury starts to leak into down their esophagus, into their stomach. But even more important than that, it starts to go into their brain. It starts to leak into their brain. It's a neurotoxin, guys. What that means is it's toxic for your brain. Those other ingredients I named off are as well. So why would you want to do that to your body? Best thing you can do is no intervention, right? Let's go non-aggressive before we go aggressive. Let's look at the body as a whole instead of just parts. The longer we look at it as parts, we never really get to the cause. We just keep putting Band-Aids over it. Let me show you some other stats here. What I wanted to talk about next is something called interferon. Now, you've probably heard me talk about that before, maybe not in a health hack, but if you're in the office, you've definitely heard me discuss that. And interferons are a great way that your body fights viral infections, and it's part of your immune system. So I said when we get that first bone working, we get it right at that angle at 31 degrees and we get it locked on, that's going to allow interferons, interleukins, tumor necrosis factor, all these different immune system type of cells to work the way they were designed to. But if life can't express, we can't fight off the flu. It's normal for your body at different points in time to burn off infections, right? So sometimes we think that fevers are bad. Fevers is just, all your body's doing is it's just burning off or cooking off bad bacteria. That's great for you. That's what you want it to do. You should be concerned when it's not doing that. That's when you need to be worried. Another thing is when you get that first bone adjusted and that immune system's working, it's going to increase your white blood cell count. So it's going to allow the mobility and activity of those white blood cells to work really hard, which is going to do what to the infection? It's going to reduce the infection, and it's actually, according to the MDs and the clinical research out there, it's a key to your body being able to fight infection. Let me find all this good stuff I found about fevers. Found some really great stuff about fevers, and it was stuff that, it was actually stuff that I actually learned as well. Come here, you little rascal. Okay, here we go. I got a good one for you. All right, so most of us get freaked out if we're over 98.6, right? And we think that that's at 98.6, if you're over that, you definitely have a fever. And I caught myself years ago saying the same thing. And actually, these studies that I'm looking at, there's 10 different research studies in this awesome article written by one of my colleagues. And what it shows is that now what they're saying is between 98.6 and 101 is still normal. Because what your body does when it gets into a different temperature, if innate's working, that inborn intelligence inside of you, it's going to adapt that body temperature. So it is going to be able to fluctuate. And it also says that when the body's nervous system awakens, the immune system's response in fighting an impending infection, many normal body activities speed up. This extra work produces heat and fever. It's that simple. So what does the research say about this? It actually says when you have more fevers in your life, that because your immune system is actually working more effectively, it's going to reduce the likelihood that you have cancer later on. I know I thought it was crazy too. This is from a journal, and this is from a, let's see here, The Medical Hypotheses in 1998, volume 51, page 4. Isn't that awesome? Wow. Like I never even knew that. I learned that today myself. Recognition that a fever is beneficial has been known to be true for 2,000 years. So why are we allowing these things, right? What doctors tell us, doctors that think from outside in, why are we really letting it rattle the resolve of what we innately know? One of my mentors, and really everybody's mentor in this profession, Dr. Sid Williams, always said, if I take keys and I drop them, they're always going to hit the floor, right? And I don't have to see research about that. I innately know that. That's called the law of gravity. Well, there's universal laws that govern your body and your body's intelligence. And that's called the law of life. And the law of life goes from the brain down the spinal cord and out over the organs to every cell, tissue, and organ so that your body can heal. So guys, let's think differently. Let's think differently. Let's be outside the box. Let's don't put the mercury back in. Let's don't put the MSG in. Right? Let's don't put the formaldehyde in. And let's certainly don't do that to our little babies and our kids. Because most of you sitting out there, I guarantee at least half of you, every time you've ever had a flu shot, what happened? You got the flu immediately, right? And then what does that do to your immune system? It actually suppresses it. And what do you find yourself getting later on? You get the flu anyways, even though you had the shot. I hear this from patients all the time. You know, doc, I had my flu shot, but I'm still getting the flu. Yeah, because it's not bringing up your immune system. It's bringing it down. It's decreasing it. Let's talk about antibiotics for a second. Why am I bringing all this up? Doc, it's only September. Yeah, it's about to be October, right? And October, November, December, that's not flu season. That's when you don't take care of your immune system season, which is why we got to get your tail in here and get you checked and get your family members checked, right? So antibiotics are great for the emergency room, but since 1975, the effectiveness of penicillin, according to the research, has been reduced by 50%. Because our body's getting used to these strands. It's getting so used to them that in areas like Rwanda, where they have high rates of tuberculosis, those rates are even getting higher because penicillin and antibiotics aren't working anymore. The bodies and people in those areas and cultures, they've gotten used to it. So guys, we got to start thinking differently. You know, the Associated Press said that doctors, this study was done 8 to 10 years ago. Doctors wrote 12 million antibiotic prescriptions in a single year for colds, bronchitis, and other respiratory infections against which drugs are almost useless, a study found. Such indiscriminate use of antibiotics has been contributed to the emergence of drug-resistant bacteria. And this was pulled together by my good friend Keith Wasson. He writes these amazing packets, right? They'll show us a lot of good research. See, somebody's trying to hate on us right now. It's probably like a medical doctor, the FDA or something, right? They're like, shut them up, keep them quiet, right? So the war on bacteria has been going on for a long time, but what we know is in order for you to get better, you got to think differently. You got to think differently. In order for your body to heal the way it was designed to, you got to start telling your family members to think differently. Because if we continue to do the same things that everybody else is doing, we're going to get the same results as everybody else. Physicians will prescribe antibiotics for viral infections 62% of the time when asked by a patient, and only 7% of the time when they think a patient does not want it. This was done by the Journal of Pediatrics. So guys, let's think differently. Let's don't continue to medicate, right? If you got a fever, when it gets over 104, right? And that's continued for day after day, I think the number you want to look at is 6 days. So if you're at 104 and it's lasting over 6 days, we want to do something about that at that point, okay? But taking a medication, taking a Tylenol, Advil, ibuprofen, all these things, according to all the research put out by medical doctors, right? That's not going to work to get to the cause. We got to start thinking differently, folks. Be transformed by the renewing of your mind. That's what the scripture says, right? Let's think differently. Let's take ownership, okay? I pray that today blessed you. I pray that you learned something, okay? And hopefully the car alarm kind of rebooted your system so that you could say to yourself, hey, what I'm doing isn't working and I need to get in and get my tail checked and help my family members get checked. And if I'm a current patient and I'm off track or I'm not doing the things that I know that I need to do to be successful, let's do that. Think differently, folks. It starts right now. At Health From Within CA is our Facebook page, 3 o'clock every Monday. Sometimes we'll be live, sometimes we won't. As much as we can, we'll try to be live. Share this, like it. We want to bless you. Make sure to follow us on the web. healthfromwithinca.com is our website. And anybody that you want to get checked right now, I'm offering a $700 exam for the consultations, the results, all that. All we're going to do is charge a small $40 administrative fee, okay? Let's get the word out there. If you have anywhere you want us to speak, you want me to go in, bless these companies with breakfast and lunch, maybe you have a church, you can reach my marketing director, Kelly Zygowitz, okay, at 760-385-8352. So God bless you. Have a great day. Take care.